engulfs it. So it clears away the infection. So because of that, there are many factors which are secreted, and what happens when it is secreted? All those factors which are secreted here, they are getting accumulated over here. So if it is there, the secretions all are getting here. So that is why you get cough with sputum, because this has to come out, na? Body will try to throw it away. So these secretions, that is called as sputum. That is why you get cough with expectoration. Okay. Another thing, yeah, that is phlegm. And fever, to I explain, because this is protective mechanism. Fever is, why it is protective? Because it gives us an idea that something is going wrong in the body. That's why the fever is very important. So another thing, so when it happens here, the space is there. Earlier it was space is there. So this is the site where the gas exchange takes place. Oxygenation is being given to this thing, and CO2 is being carried out. So but here the space itself is reduced. It's being reduced because of secretion. Earlier it was not there, but now the secretions have come, na? So it will hamper the gaseous exchange, the O2 delivery to the RBCs. It's being hampered over here because of this secretion. Because earlier it was clear like this. So oxygen could easily go in, carbon dioxide could easily go out. But now because of the secretions and all, this is a problem. It's being hampered, obstruction sort of thing, because it's creating problem. So now what happens? That's why the O2, which is oxygen, which is very, very important to your body, that's being reduced. So now what happens? Body has a mechanism. It will try to gain oxygen. But by what way it can gain oxygen? Because air. Then patient will try to breathe as much as air as possible. So that is why you get fast breathing. Okay, that's why respiratory hunger is there. So these are the main symptoms, like hunger for breathing, cough, fever. These are the main symptoms which are present in this thing. That's what I have explained. You got an idea how this thing happens? So, but how these microorganisms gain access? First of all, I'd like to tell you briefly about the host defense factors, because everything, if it is there for survival, everybody has defense mechanisms. Every system has got its specialized defense mechanism. So what are the host defense mechanisms that help so that these organisms or whatever there is present outside does not go inside? So what are these mechanisms? These are mechanical factors. Mechanical factors means they mechanically obstruct the thing. See, there are hairs which are present inside your nose. Why they are present there? Because when you breathe, there are a lot of particles, dust particles, which are greater in size. So they get obstructed there. They cannot go inside because the hairs trap them. There's something, and there is a turbinates. I explain why the turbinates are there. There are 3 bones. Because of that, the whirling of the air occurs. And there is a branching architecture of the tracheobronchial tree. So why the branching nature? Because it's not in a straight line. If it would have been in a straight line, see, if something comes over here, if this is a straight line, it will directly go in. But it's not like that. It's here, then it's here, then it's here, then it's here. Because somewhere it will obstruct. It will not go direct to the lungs and alveoli, where the main problem is there. The another thing is mucociliary clearance. There is something called as cilia. Cilia is present along with the respiratory tract. All the respiratory tract which are shown, they are lined by some specialized type of cell called as cilia. What is the cilia? They are hair-like structures. Suppose if this is a cell with the nucleus, so these are the cilia. So what do the cilia do? If the particle is coming like this, or the microorganism is coming like this, it will beat. It's like when the water coming and you that this thing, this will happen like this. That's called the beating action of cilia. So that will clear. If it is coming here, यहाँ पे आने के बाद it will beat like this. It will go like this. So whatever is coming here will be thrown out. It will be pushed. So that is ciliary defense, mucociliary defense, and that way many of the organisms or many of the dust particles and all, they are cleared by this ciliary reflex. There is something called gag reflex, cough reflex. Gag reflex is when you sometimes you feel like I want to vomit because something is there in my this thing. So what do? You put your fingers, you just try to touch your this thing and you vomit. That is called as a gag reflex. So by that way, anything which is touches there or anything is foreign to this thing, will try to throw out. That is gag reflex. Similarly, the cough reflex is there. When the cough we do, it's protective mechanism. So whatever is there, we try to throw out. Similarly, cough reflex. And there is something normal flora adhering to the mucal cell of the oropharynx. So that's along with that ciliary cells, there are other flora. Flora is called as some bacteria or some organisms which are present there, but they are common cell. Common cell means they are not harming us. We are not harming them. They are not harming us. But we have a benefit from them. Why? Because they adhere and they do not allow the organisms to enter the respiratory tract. So another thing, macrophages I explained, those are the large cells which helps in engulfing of the organisms. And there are this something called surfactant proteins A and D. They have antigen A and D. They have antibacterial and antiviral properties. That means they can directly kill the bacteria and viruses. So despite of all those things, then why does it occur? There are many defense or mechanisms, but why does this occur? So these are the things. There is some limit to this thing. If the larger particles are being obstructed, but the microorganisms, if it is very small, it cannot be obstructed by any mechanism. So it can directly gain access to the this thing. The another thing is that hematogenous spread. Hematogenous spread is like from blood. Many of the times the person has particular type of infection, any type of infection, the organisms are present in the blood, but when at that time the immunity of the person is lowered, and that time by the blood the organisms can gain access to the respiratory system, because blood is going everywhere in the body. Blood is going everywhere in the body, and blood delivers the oxygen to the every cell of the body. So that is why if something is present in the blood, it can go to any part of the body. So these are the things. Fever is caused by IL-1 and TNF, tumor necrosis factor. So these are the release of chemokines by interleukin 8 and granulocyte colony stimulating factors. So that process I already explained, why this fluid comes and fever. So what are the stages of pneumonia? In pathologically there are 4 stages. The first stage being pulmonary edema. At first there is only edema of the interstitial cells, but the second stage there is something called the red hepatization. Why the red hepatization? Because along with the WBCs, see, after this thing, these microorganisms are causing injury to this epithelial cell. If this is alveolus, this is epithelial lining. The cell lining which is covering is epithelial. So when the microorganisms are there, by various mechanisms, they injure these things. So now it is being injured. So every cell is, there is some limit, like permeability and non-permeability. Particular type of cells are permeable, that is they allow to go and come to particular diameter of the substance. Like, but the proteins and all, they are very heavy. Their molecular weight is large, their size is large. So this time when the injury has occurred, so whatever the substances are there, they can go in, they can go out. Earlier what used to happen, only oxygen and CO2 was going in and out. But here, because of this injury, the permeability is hampered. Suppose it's like defense system of any nation. if the defense system is strong, it will not allow any enemy to come inside. But if suppose this is the map, from here everywhere it is normal, but at this part if the system is weakened, so enemy will enter, obviously enter, right? These people were not allowing the enemy to enter, but now they have some problems. So they will allow the enemy to enter. So similarly, the substances which were not allowed earlier, they will enter now. So similarly, red blood cells of your body, they will enter here, and that is why sometimes you get sputum with blood in pneumonia, because red cells are entering here, and from here obviously we are going to cough it out. So that is why you are getting sputum with the RBC. So this is the how. And then over here the red blood cells have come, so that is called as this red hepatization state. But red blood cells, when have come here, they have certain lifespan. So below that, beyond that, they'll die. So in the third stage, no new RBCs will come. Whatever present are there, they'll die. And that is called as a gray hepatization. And the fourth stage, because of that, everything will lessen. This will try to repair because of the proliferation, because the cells have regenerating property. Cells die, they regenerate. The other cell takes over. So then it becomes normal. This is resolution. Now the infection has resolved. Excuse me.
Gray hepatization is an indicator that the patient is recovering or the pneumonia.
No, from the gray hepatization, gray hepatization is indicating that from there it can have two courses. Either it can go into complication, or if any other complications are not there, the recovery is good, antibiotics are good, then it will resolve. It's the only sign. It's just because of the RBCs are dying and the process of healing has started. That is why it is gray hepatization. But the further course will depend upon what the antibiotics are, how the antibiotics are given, and presence of any other illnesses, comorbidities. Beyond from that, either it will resolve or it will go into complication. So now this alveolar, and another thing, from here there is a leakage because the injury has occurred. So the fluids which are there, which are present, earlier there were fluids which for attracting the soldiers, so they are present, so they'll leak over here and they'll